Hi everyone, welcome to today's Face Facts by Dr Yusra podcast. On today's podcast, I have the incredibly talented and knowledgeable urogynecologist, surgeon, Miss Shireen Ali. On today's podcast, we have talked about vulvovaginal atrophy. These changes can happen anytime during your life, but may be more common during the perimenopause and the menopause. And symptoms may include pain, discomfort, itching, and discomfort during intercourse. If you have any question about the female intimate areas, then please leave comments down below and we will get back to you. If you want to get in touch for a consultation, please feel free to do so. And I hope you enjoy today's podcast. So welcome to the podcast. Today on the podcast, I have the amazing Miss Shireen Ali. I think people get really confused about the term Miss versus Doctor. Miss basically means surgeon. So can you introduce yourself and then I will tell everyone what we're talking about today.
So you can call me Miss or Doctor or just Shireen. Either is fine. And as you said, people do get confused about this term. And in the surgical world, when somebody sort of attains their post-graduation and, becomes a consultant, they're usually called a Miss or a Mister. But Doctor is fine as well. And none is fine as well. So I am a gynecology consultant and my special interest is urogynecology, which is the health of women with regards to urinary incontinence, urinary symptoms, prolapse-related symptoms. But I also look after ladies with vulval pain, vulval discomfort, pain during intercourse, as well as other general gynecology conditions. So those are the things
So what's the difference between a urogynecologist and a gynecologist?
That's an amazing question. So in gynecology, there are several subspecialties. For example, there is fertility, there is endometriosis, there is urogynecology. So many years ago, actually, probably not that long ago, maybe about 25 years ago, we realized that, there are a large group of women who have symptoms of prolapse, but also with that, they can have urinary symptoms. And what we were finding previously is that they were almost kind of sent from pillar to post. For example, the urologist would look after them to look after their urinary symptoms, and the gynecologist would look after them for their prolapse symptoms. And we realized that we need somebody in between, because if a lady comes to me with symptoms of prolapse, she may have urinary symptoms as well. And it's a difficult symptom to talk about. Even now, even in 2024, it's not easy to talk about that for any woman. And it's just that because we do this, we naturally will, in a nice, comfortable way, ask them about urinary symptoms as well. And similarly, if they come to you with urinary symptoms, it is hard for a lady to actually say, I have some difficulty in intercourse as well. So again, belonging to this specialty, the way we are trained, the way we look after our ladies, we will have a much more holistic approach because it's pelvic floor in the end of the day. So you've got your bladder, vagina, uterus, bowel. All three organs can get affected in a woman. So that's how this specialty basically came into existence. And obviously I do it and I love this specialty. And I think that's one of the best things that helped women in gynecology, having somebody with that sort of mindset.
Such a subspecialty. And, having been in a position where you from afar have helped with my looking after me when I was pregnant and having my baby and advising me that that's enough, that 3 is enough to maintain my pelvic floor. I've always found you to be so easy to talk to, and
thank you.
You have a real wonderful way about you. Honestly, I'm not saying this for I've said this to you so many times.
Thank you.
You have an amazing way of making women feel comfortable and removing the element of maybe shame or embarrassment about talking about a very intimate area. Perhaps an area that has been stigmatized and they don't want to admit that they're suffering with. I've been looking after women for 14 years, and only now, as I've held the hands of these young ladies who've come to see me in their youth when they're getting to know their boyfriends, and then they get married, and then they have their children, and then they go through the perimenopause, things change anatomically, physiologically, things change. And now I'm starting to see them opening up about concerns that 5-10 years ago they weren't. And that might be because I'm looking after a population that's aging and undergoing these changes. But I still see that they are embarrassed and they're a little bit shy to talk about it. And I'm very passionate about creating a safe space where they can talk about anything and everything without shame. But I'm also very aware of my scope of practice and my limitations, as you know.
Yes.
And I say to my patients, look, I'm not the right person to look after you for this, but I have someone who is. And I refer them to you. And so today I want to cover the topic. We have so much to talk about. I mean, we could talk about pelvic floor. We were talking about this earlier. Do we talk about urinary incontinence? Because we treat a lot of patients. You treat a lot of patients for that. Do we talk about pelvic floor? Do we talk about prolapse? What is prolapse? What are the different types of prolapse? How do you know you have prolapse? What's anterior prolapse? What's posterior prolapse? What about vulvovaginal, vulval changes that happen with aging, fissures? There's so much to talk about when it comes to women's health, women's intimate health. And because of time, we're going to segment this and talk over stages, over different series and podcasts, so that we can really help our patients to understand the physiology, the anatomy, the changes, and feel empowered to look after themselves and seek help where necessary. So I want to talk about polynucleotides today. And I'll explain about polynucleotides. And then I'd love to hear about your thoughts on the use of polynucleotides in the vulvovaginal area. So polynucleotides is a term that's been used very loosely recently and has become quite a buzzword, I would say, over the last 12 months. And I've done a podcast solely on polynucleotides with one of the founders of a polynucleotide company that I work with. And you can go and listen to that. That's with a guy
I've already listened to it. It's brilliant. Yes.
And I think it's important to distinguish what polynucleotides are, where they are sourced from, and what makes each one different. Because you can have, I don't drink, but you can have wine that comes from different types of grapes.
Yes.
You can have different types of cheeses. The word polynucleotides doesn't mean all sources are the same. All mechanisms of action are the same. And I think it's really important to understand that. So in this context, we are talking about polynucleotides that are strands of DNA that are sourced from fish. And you can have them sourced from wild salmon, which is usually what they used to be procured from. And because of regulatory changes, many of them are now being procured from the gonads of salmon trout that are farmed. But they're not all made equal. They're not all sourced and filtered in the same way. So the brand that I work with and that you work with is a brand called Dermafocus, and the product is called Plinest, which is sourced from farmed salmon trout. And the polynucleotides are sourced from the gonads of that salmon trout that has actually been farmed for food. So this is very different to where polynucleotides are being sourced from wild salmon, and we don't know the life cycle of that wild salmon, what they've been exposed to, and how it may have been impacted their DNA. And the wild fish are often caught for the sake of taking their sperm and extracting the polynucleotides from that sperm. This is different. This is a byproduct of a food-sourced fish, and otherwise the gonads would be chucked away. So I think from an ethical perspective, that's important. It's important to me that I know that we're not masturbating wild salmon. And I've heard a lot of people make podcasts about odd things happening with fish, and therefore have been put out very odd. So I think it's important to understand the source of the polynucleotides, because honestly, if we look back 20 years ago, and someone said to you that we'd be taking fish sperm, or be taking breast milk of cows and putting it on our faces to rejuvenate and make us younger, it would sound very odd, and we would think, what is going on, right? So I think understanding the morality, the ethics, where we're getting them from, the science behind it is important. And for further detail, I'd say to my patients, and anyone listening, go and listen to the Polynucleotides podcast, because you'll understand more about that. But for the purpose of today, we're going to be talking about polynucleotides that are being sourced from farmed fish. These are strands of DNA taken from the gonads and then chopped into little pieces of amino acids, okay? And then they are filtered, and I think this is very important. They're purified. So this particular brand make polynucleotides that have highly purified technology, which is different to other sources that might not be purified, and other sources that might have a lot of excipients. And why I want to make this differentiation is because as this buzzword is becoming more and more and more popular, and people don't understand the difference, they're sourcing cheap polynucleotides of very dilute concentrations that are not filtered and that have a lot of excipients and are developing granulomas. This is something that has been documented and is now in the press. And we have to make a distinction between CE marked purified technology products and products that are not and sourced from questionable sources.
And that applies to every single thing in medicine and in surgery. If we are going to do something for a human being, if we're going to operate on them, or if we're going to put something into their skin, we have the responsibility of making sure that where it's coming from is safe and doesn't cause any harm to that human being. To me, that's the most important thing. And I've said this to you before as well, that if there is a treatment that I will not use on myself, on my mother or my sister or my friend, I will not actually promote it, or I will not advise it to patients. And again, the quality of the product, the quality of the substance that you're using is, to me, in my mind, it's non-negotiable. It has to be the best.
I agree with you entirely. And I think also there is a level of reassurance that I get when I know that a product is regulated.
Yes,
I don't use anything in my clinic that's not regulated, that hasn't been tried and tested and has scientific data behind it. So what we're talking about today is the use of polynucleotides for biorevitalization of the vulvovaginal area.
Skin, exactly. Like skin on your face, the skin down below needs exactly the same care as the face would. And for me, I use it as an adjunct to the treatment protocol, to the treatment plan that we offer the ladies. And that's why I feel that when we have ladies who have symptoms of vulvovaginal atrophy, when they present with a multitude of symptoms or just one symptoms, it is important to do a comprehensive review from a gynecology perspective, and then to sort of put together a treatment plan that doesn't just include polynucleotides, but includes other treatment options as well. And in many cases, especially in my clinic, I see many ladies who've been to sort of other places and they have seen other clinicians and basically feel that, is there anything else that can be done? And I think this is a very good treatment option for those women. I think the selection of patients, the selection of women for this treatment has to be done very carefully. We need to sort of do a very thorough assessment. And for these ladies, this is a very good option, and it does make a big difference to the treatment. And I always say skin down below the vulva, the vagina, the perineal area is no different from the skin anywhere else in our body. And when we are helping that skin with different treatment modalities, why can't we do the same for down below?
Absolutely.
And when the skin is happy, when the skin is nourished, when the skin is comfortable, overall, the woman will feel better down below. So yeah, it's a very good treatment option for this area.
So I want to, if it's okay, if we can just go into a little bit more detail about the anatomy of down below, so to speak, because I think people don't understand the different terms that we might use: vulva, vagina, perineum. Can you, without a photograph here, we can put a photo on. We can put a photo on later.
And you know how particular I am about that. And I have concerns the way sometimes these treatments are advertised, because they keep using the word vaginal polynucleotides, where in reality it is actually vulval treatment. So at the moment we offer this treatment to the vulval skin. So how do I describe the anatomy? That's the interesting.
So the vulva is the outside.
It's a very good question. So the vulva is basically the outside. So for a woman, the skin that is on the outside, the skin that we can see is the vulva. And as we go, and if we were to examine ourselves, then deeper down, deeper inside starts the opening of the vagina, and that actually then leads into the actual vaginal canal. So what we can see on the outside, and sometimes when women come with symptoms, I specifically ask them, is the symptoms on the outside or the inside? That's how I can sort of help them to understand that this is actually on the outside, and that is vulval skin, and on the inside it is vaginal skin.
So the outer lips are the vulva, and the inner lips?
So the outer area of the skin
labia.
is the vulva.
Mhm.
But then when you talk about the lips, there are the outer lips, which is the labia, or the bigger lips, which is the labia majora.
Okay.
And in fact, they don't look like lips. They
Oh,
are
they're
like
not.
skin
Yeah.
folds. And then in normal language, women will refer to the lips, which are
Yes.
actually the inner lips. So that is the labia minora. So the outside where the skin is folding and covering the inner lips is labia majora. And when you separate that, and inside when you see the lips, the inner lips that people would normally refer to, that these are the lips, is actually the labia minora. But then the skin that covers you on the outside around these folds is the vulval skin.
So why might somebody want to have polynucleotide injections or biorevitalization of that area?
So it's generally speaking, women will complain of dryness. Women will complain of discomfort and itching, loss of elasticity, loss of sort of stretchiness of the skin. These are usually the general complaints. But sometimes with this, there will be other complaints such as urinary urgency, maybe some urge incontinence with it, difficulty with intercourse. So it's a combination of symptoms. And then, of course, these symptoms have to be linked with the vulval and the vaginal examination by the clinician as well, and then linked with the previous treatments or possible previous diagnosis. So, by and large, we see women with history of lichen sclerosis, which is a skin condition that can happen to the vulval skin. We can see ladies who have history of the perimenopause or the menopause, and the word that we talked about previously as well, the genitourinary syndrome of the menopause. So they will mostly be ladies with these complaints who will come to us.
When you say symptoms of perimenopause or menopause, which ones?
So again, perimenopause, menopause is not just hot flashes and night sweats and feeling tired or having brain fog. We forget about a very large part of menopause that can be symptomatic is down below. So, you can get dryness, you can get discomfort. And like other things that we were talking about, it's almost accepted. It's okay to have it. It's not. So it should be treated. And if things don't feel comfortable down below, then you can't function. You can't do the things you want to do. So when you talk about perimenopause and menopause, this is part of that sort of symptomology as well.
And so how can polynucleotides help with that?
Polynucleotides, as you said, they help with biostimulation. They help with regeneration of the sort of collagen, which helps in better subcutaneous tissue. It helps with the water content within the tissue. It helps sort of with the elasticity and the stretchiness. So it creates comfort. It reduces itchiness. It reduces soreness. So it can help with all those aspects. That in turn gives you comfort. That's what you want in the end of the day. We have seen women who have also reported improvement in urinary symptoms. It may not be sort of the number one treatment for urinary incontinence or urgency or urge incontinence, but it definitely can help with the overall sort of symptomology and the presentation.
And it's also the product that we're using is a product that has a combination of ingredients from polynucleotides, hyaluronic acid, and also mannitol. So there are added benefits of hyaluronic acids. I think a lot of people think of hyaluronic acid as this thing that we want because we want our skin to look glowy or hydrated, but actually it's also the feeling, as you say, of hydration and discomfort, and understanding that the way that polynucleotides work when we are injecting them is by recruiting fibroblasts. So fibroblasts are the cells that make collagen, elastin, glycosaminoglycans, hyaluronic acid. They create all of that important goodness and the nutrient-dense amino acids, all of the important stuff that is present within skin. That helps it carry out its function, not just the aesthetic, but actually the function of skin.
Functionality is probably the number one indication for this more than anything else. And all of this goodness that is in the skin can decline with time slowly, especially during the perimenopause and the menopausal period, but more so actually post-menopause. I see more ladies. So in our practice, we will see ladies sort of in their 40s or 50s with symptoms of hot flashes and night sweats, but we will also see ladies sort of in their sixth or their seventh decade who will come to me and say, actually, I never had any menopausal symptoms. Why are you saying to me now that I have menopause? So that's a very common question. So that's where I think it's really important to give time to the women, to sit with them and to explain to them that you may have been one of those very lucky ladies who went through the menopause without any complaints, but now the further decline in the estrogen is actually creating a little bit of a problem down below, which is so easily curable, rectifiable. It's so easy to do it. And it's so nice to see women when you've given them a simple treatment and there are incredible results with significant improvement in their symptoms and their quality of life.
Quality of life,
Quality
ultimately.
of life is huge in this. And this is again coming back to the same thing. Why didn't we have urogynecology before 25 years? Why did we not talk about menopause up till now, recently? So similarly, I think there are still many things in women's health that are still not talked about, especially health down below is very important.
What would you say when patients are feeling shame or embarrassment about talking about the subject? I've even had people say, "Oh, I'm surprised that you're talking about this on your podcast."
Yes.
What would you say?
It's
I find that quite sad when I hear, but
it's a difficult one, and there's a fine line in kind of almost making them feel bad about not talking about this. So you have to be very sensitive and very sort of mindful of how you approach it. And we've done this for 25 years. It comes to us naturally. For me, if we're going to have a consultation, I want to make it feel like we're sitting in a lounge on a sofa and just having a conversation rather than you coming to a clinic, sitting on a chair and the doctor is sitting at a desk. I've always tried to make it a two-way conversation. Before anything, I always ask the women, what would you like to do? Have you read about anything? Have you researched something? Is there something that's in your mind that you want to talk about? So we always start our conversations like that. And I think having a two-way conversation is really important. And that comes with time. And unfortunately, within the NHS, there is no time. And even within the private sector, and the consultations in the private sectors can be quite short as well. They're not necessarily long. But if you're going to look after somebody, you've got to give them time. And time gives you the ability to make them comfortable, to give them time to talk about things and not rush them. And that gives you that relaxes the person. I think
totally.
That's really important, I think.
Totally. I'm so selective about who I bring into clinic, as you know.
I know.
And the way that I run my practice is that my consultations are long. I give my patients time.
Yeah.
Sometimes it means we run over if a patient has
Yes.
significant needs. That's the nature of healthcare. But time is something that we cannot diminish or dismiss the importance of, the value of for our patients. Even me as a patient, when I feel rushed, I get angry, I get upset. And the doctors that stand apart from me are those who have given time. So credit to you because you are amazing at what you do.
Thank you.
And if anybody wants to talk to you or come in and discuss any of their needs, whether it is biorevitalization or dryness or symptoms of the menopause, urinary incontinence, urgency, fissures. I know you deal with a lot of
unhealing fissures, lichen, sclerosis. There are many conditions that ladies can have down below, but there are some conditions that are very common. And even to this day, I find that there are still quite a large number of women who've just been living with it and they don't come forward. And we really wish that, people approach us or anybody else to come and talk about this. They don't have to have the treatment. They don't have to have the steroid cream or they don't have to have an antibiotic cream. They can just come and talk about it and then think about their options. Go home, think about it, go and do your research and then decide what you want to do. The only thing I would say is don't leave it, treat it, don't suffer in silence. That's really important. And again, on the subject of polynucleotides, it's definitely another tool that we can use in sort of our choice of treatments. And I think also that for women who are having to use steroid creams, for example, quite regularly, the use of polynucleotides probably will reduce the amount of time they have to use steroids. They may still have to use it, and that's why I keep using the word adjunct. I'm very honest and very open about what a treatment can provide. So that's where I would say a holistic approach is really important. And a new treatment such as polynucleotides that, you're so experienced and so fantastic in using it. And you've seen with your own eyes what a big difference it makes to the quality of the skin, to that sort of what is underneath your skin, to those different layers of the skin. And you just feel it's something that's amazing that can help so many women with the sort of right combination of treatments.
I agree. So the product that you're using in clinic at the moment is Nugyne,
which has hyaluronic and mannitol, as you've explained. Yeah.
It's 40 milligrams per ml of in the product, and there has been clinical research, scientific papers published about the improvement in the skin health and the comfort levels of the patient. But I think this is an area that is rapidly developing, and research will continue to be done. And I'm excited. I'm excited to see it. And I'm happy that we're offering something that we know can help women. And I would encourage anybody, as you say, if they are suffering, please don't suffer in silence. Please reach out.
Go and see
someone, even if it's just a chat to figure out, are my symptoms normal or abnormal? Is there something that can be done about it? And you've so eloquently told me in the past, it might be something as easy as using lubricant.
Yes.
It might be estrogen gel down below. Yeah. It doesn't have to be surgery. You're a surgeon. Yes, you do surgery day in, day out. But I think people are afraid of potentially having to have really drastic treatments.
Yes.
But these are often... we in medicine always say simple things first. Start with the simple things first.
And simple things always work. And the vast majority of the world, the vast majority of women are treated successfully by simple treatments. And it's only a smaller number of ladies who require more things or more treatment. Talking about the treatment and what it involves, for example, these are small injections, tiny little injections, very similar to the ones that are done on the face. We just do it down below in the same way. We apply local anesthetic, numb the area, and it's not a painful treatment, but it can be a little bit uncomfortable. Some ladies find it uncomfortable, some don't feel it at all. And we do one treatment session. It takes us about half an hour to do it. And then after that, we will assess them in 2 to 3 weeks and repeat a couple of more sessions. So normally I say every 3 weeks, 3 sessions, and then see how you are. But we may combine it with other things such as estrogen for the vagina, a simple moisturizer for the vulval skin, and other lubricants that can be used intimately as well.
Amazing. Thank you so much. I really hope this helps our ladies. If anybody wants to get in touch with Dr. Shireen Aleem, please contact the clinic, info@dryusra.com. We'd be delighted to have you. And if you have any questions, drop them down below and we'll answer.
Thank you. And thank you for having me.
Thank you for coming.